I went to Hagley Gap Jamaica, and it was the spring break of my M1 year, which was the last week of February 2008. Hagley Gap is about 2 hours outside of Kingston. It's up in the mountains. It's just very isolated, very rural. The living conditions are mostly 1 or 2 room houses or huts, and there's not running water really. There's large extended families that generally live together. There was 8 M1s, myself being one of them, and then there was a group of 4 M4 students who were on a month-long international rotation. They had been there for a week, and so we met them down there for their second week, and then they stayed on another 2 after us. And there was a family medicine doctor from Michigan that came down with his entire family as well. We went to Hagley Gap to staff the clinic for a week and to provide medical care. The clinic is run by volunteer groups that come in. Sort of the way it was set up is there was a waiting room. When you walked in, there was chairs set up, and there was a sign-in sheet, and we just took people as they came, and out in the waiting room would do their vital signs, so get their blood pressure and their heart rate and height and weight, and ask them what it was that they were in the clinic for, and kind of get a sense of that. And then we had exam rooms that were, more private, so we could take the patients in one by one. And since we're first-year students, we don't have a lot of patient experience so far, so a lot of what we did was get a really detailed history as much as we could with the questions that we knew to ask, and then do an exam as much as we knew how. I guess I just thought that, I've only been a medical student for 1 year. I don't have enough information in my brain to be able to actually help somebody at this point and make a difference. And I found that I did, and I didn't by myself, obviously. I needed the 4th years and the doctor and my peers, the other M1s, to kind of talk things out and figure things out. But it really made me realize that we're in a profession, or we're going into a profession, that you can really make an impact on people's lives. I'm just really grateful that the University of Michigan allows students to have experiences like this, because it's not only a learning experience, but also I think in your first 2 years, when you're spending so much time studying and sitting in the lecture hall and reading and not actually having much patient experience, you don't forget why you're going into medicine, but it's nice to have a reminder once in a while, and this was a perfect opportunity for that, to actually put your knowledge to use.